Hi guys, if you've been watching RCH1 and RCH2, welcome back to RMNCH+A, the last one in this series. If you haven't watched RCH1 and RCH2, I highly recommend you do watch it because they have certain information that you can use to kadadachify here also, that's why. So from the structure of notes, you can see that this was not written by me. A really kind friend of mine wrote this out and it was super useful and super simplified, so I thought why not use the same notes. In RMNCH+A, the thing is that they have included adolescent as a completely separate age group, like they are concentrating on them. So this was started in 2013, and what are the components in here? Obviously the first one is adolescent component, and the next one is we are linking the maternal and child health to all the other things, that is the reproductive care, the family planning, the adolescent care, HIV, everything we are linking it, okay? And then we are also linking home and community based services to facility based care and making sure that referrals and counter referrals are happening properly, okay? And this program is mainly carried out in 184 high priority district, and we'll be moving on and we'll be seeing goals and strategies, but the whole strategy thing is actually made into a box form in page number 501. You can also check that out. So the main goals and targets to be achieved in RMNCH+A is these things, okay? And it is given by the mnemonic SIFI APOE. S refers to skilled birth attendant and I refers to immunization, so it's kind of easy. So, and why do we have this mnemonic? So that like this mnemonic is placed in such a way that the numbers align correctly, like you can remember it, and I mean you can see it's easy, okay? The goals and targets are made in such a way that these targets should be increased, all right? Skilled birth attendance should be increased, immunization should be increased, and then these targets should be decreased. Total fertility rate should be decreased. Under 5 mortality should be decreased. Anemia in adolescent female adolescents should be decreased. Alright, and this is also arranged in a way that you can easily remember the numbers: fertility, under 5 mortality, and then anemia. And now moving on to the strategies. So there are strategies in each of the category: reproductive category, maternal category, newborn category, child category, and adolescent category. So firstly, we'll be looking at maternal category. In this, when a woman gets pregnant, the first thing to do is registration. So that is the first strategy. And then we have to detect high risk. And then we have to, if there is any maternal death at all, we have to review it properly so that it can be avoided the next time. And then misoprostol is being delivered at 8th month to selected cases in the rural and community level during the 3rd stage of labor. And there are also MCH wings that are specially created in high case load facilities. So these are the strategies. Next is newborn strategies, where there is essential newborn care, special newborn care. All of this you can, if you had seen RCH2, they're the same thing. So if you had read over there, you can totally write down points from there, okay? And to prevent infection in the newborn, breastfeeding is exclusively promoted, and also gentamicin is approved to be used by the nurses at community level itself to prevent infection. So next thing is child care. I mean, after newborn comes the child care. So in here we have to make sure the main target is nutrition, okay, to prevent severe acute malnutrition. So we have to give complementary feeding, nutrition, and we have to prevent, and IMNCI comes over here also. So if you have read IMNCI, you can write about that. Acute diarrheal disease should be prevented, and acute respiratory illness should be prevented. And RBSK comes under here, okay? That is Rashtriya Bal Swasthya Karyakaram, in which we screen and intervene at an early stage itself for 4Ds, which is disease, any deficiency, defect, and disabilities. And how do we screen and intervene? We go to Anganwadi centers and we go to government schools. That is how we detect it, okay? And then we refer to higher centers and then make sure the children are getting immunized properly. And as we have seen from RCH 1 and 2, the referral service is very important. Okay, next thing is reproductive health. In here, we'll be looking mainly at postpartum intrauterine contraceptive devices. So this devices, they have to be given at all facility, and also the ashas, they will go and deliver it in home itself. They will also deliver pregnancy testing kits. We have been seeing from RCH 1 and 2, we are seeing comprehensive abortion care. Here also it is being given, and also quality sterilization services plus transport, as we are seeing from RCH 1 and 2. And there's something called delivery point. Okay, so they have been divided into L1, L2 and L3 based on the number of deliveries they are conducting per month. So in L1 they'll conduct 3 normal vaginal delivery. In L2 they'll be conducting 10 normal vaginal delivery plus complication management also. And in L3 they'll be conducting 20 to 50 normal deliveries plus also cesarean section. So that is that. And then the most important thing, which is adolescent health, where we'll be counseling about menstrual hygiene, and we'll be giving out iron folic acid weekly, and we'll be advising about contraceptive use in adolescent. And the most important thing is the ARSH clinic, okay, which means adolescent reproductive and sexual health clinic. And we'll also be giving out health peer education. So all of this comes under RKSK, which means Rashtriya Kishore Swasthya Karyakaram, which is implemented for adolescent, which is age 10 to 19 years, and this came into action in 2014. So we'll look at what is ARSH. Under ARSH comes AFHC, which is Adolescent Friendly Health Clinic, and counseling centers and outreach. So 3 of these things constitute ARSH. Okay, Adolescent Friendly Healthy Clinic is nothing but it will take place at a specified day in PHC and CHC. 1 day at PHC and 5 days at CHC. Okay, in that they'll be targeting about menstrual problems, and they'll be giving out contraceptive. They'll be taking care of reproductive tract infection and sexually transmitted infection. They will even give antenatal care, and they'll screen for anemia, etc. So, and they'll also give counseling. Okay, so that is called facility based counseling service. And what kind of counseling will they offer about sexual abuse, for delayed marriage, the complications in early marriage, and mental health, etc., etc. So they're like awareness, promoting awareness via the counseling session. And outreach programs, they exist for adolescent who actually cannot come over here, or they are hesitant to come. So for them, all of these services that we saw above, they'll be given. The healthcare workers, they'll go and give. So that is outreach program. They'll go to the rural areas and they will provide all those services. And the next thing will be coming, the next strategy under the adolescent component is WIFS, which is weekly iron folic acid supplementation. So in here we'll be screening for anemia, and we'll be giving out 60 milligram iron and 500 microgram folic acid weekly. And also biannual deworming, because hookworm is a major cause of iron deficiency anemia. So here we'll be giving out albendazole 400 milligram at 6 months interval, and we'll make sure to promote nutrition which has more iron content, and we'll advise about sanitation. And again we'll be talking about menstrual hygiene. And the main aim of this program is to make sure that all of the adolescent girls are getting sanitary pads. For that they'll get the sanitary pad, that is called sourcing, and then they'll store it, and then they'll distribute it, and they'll also teach about safe disposal. The ashas and the other workers, they will also be given training on how to teach about menstrual hygiene. So the next one is monitoring and evaluation. So for that we'll be using 2 indicators. Okay, so one is dashboard indicator and the other one is survey based scorecard indicator. So for dashboard indicator, they're actually all of them are proportions. So for each of them, they'll be having a denominator, like we have to compare it to something. Dashboard indicator actually includes pregnancy care, childbirth, and then newborn care, and reproductive health care. Okay, so in pregnancy care we'll be talking about how many people registered at the first trimester itself, and how many people are receiving iron folic acid, how many people received TT injection or booster in proportion to total antenatal care registered. So we'll be looking at in proportion to what. Okay, in everything we'll be looking at that. And for childbirth we'll be looking at skilled birth attended home delivery to total home delivery, and how many of them delivered at institution to total ANC registered. So like that we'll be seeing. So for newborn indicator we'll be seeing how many newborns were breastfed from within 1 hour to total live birth, and how many newborn were less than 2.5 kg out of all the newborn weighted at birth, and then how many of them received measles vaccine out of total live birth. And indicator for reproductive health care includes postpartum sterilization out of the total sterilization, how many males got sterilized out of the total sterilization, how many of them used the IUD method of contraceptive method out of all the family planning method. Okay, and so that is all about dashboard based indicator. The next one is survey based scorecard indicator, and this is pretty easy. Like you can write everything that we studied so far. Like mortality means under 5 mortality, infant mortality, and fertility refers to total fertility rate, nutrition, birth weight, low birth weight, underweight. So we can just pneumonia, diarrhea. So all of these things we can write by ourselves. Okay, so include that too. The other thing that I forgot to mention is in newborn component, one of the strategy is Indian Newborn Action Plan, which came on 2014. The main thing to write under this is actually the essential newborn care and special newborn care unit and the newborn stabilization unit. We can also write about everything that we studied about newborn care that we studied so far. Okay, RCH1, RCH2, and over here also. So that is all about RMNCH+A. So hope this video was useful. Take care everyone, and stay home and stay safe.